Hey, it's me. Let's do some jargon. So, I've been doing some preparation for our trauma course, and all the details are going to be in the link, but been doing some work around head injury, traumatic brain injury, and spinal cord injury, just sort of refreshing and updating our program. There's some terminology that is something that if you're not working in a spinal cord unit, you may have only ever heard and probably forgotten what they mean. So let's look at two jargony terms. The first one is poikilothermia. Poikilothermia. This is what it looks like, poikilothermia. Poikilothermia is when a person has a spinal cord injury, usually above the level of T6, so sort of mid-thoracic vertebra. And there's a complete injury to the spinal cord that causes loss of sympathetic tone and that feedback mechanism that tells the brain what the body temperature is. So the body assumes the temperature of its surroundings. So if your trauma patient is lying in a really air-conditioned, cool trauma room, then they become really profoundly hypothermic. They drop their body temperature to the room temperature. It's called poikilothermia, kind of a bit like a lizard or a snake. You know how reptiles do that? They've got to go out in the sun and lie on a warm rock to bring their body temperature up. Well, patients with high spinal cord injuries can fall into the same category, poikilothermia. The other one is really interesting, and it's a form of cord syndrome that happens when somebody has a spinal cord injury, and it's called Brown Sequard syndrome. Brown Sequard syndrome. And it's really interesting because one half of their body, below the level of the lesion, they've got feeling but can't move, but the other half of their body, they've got movement but they can't feel. So there's a loss of sensation on one side and a loss of motor function on the other side. Brown Sequard syndrome. Really interesting. Anyway, we're going to talk about it more in our trauma program where spinal cord injury is one of our sessions. All the details are in the link. Hope I can see you in Newcastle. Bye.